Hi there, this is Lori Edge-Hughes, and this is your 4-Leg Rehab Minute. And in today's minute, I want to talk about spinal issues that can come up after anesthetic. Now, this is something that I have seen a few times, and actually the impetus for this Rehab Minute was a little dog that came in not that long ago to see a colleague of mine, a little Frenchie who was walking head down, and you can tell she was sore, and I'm like, oh, baby girl, I hope you're seeing Margaret today, because it looks like your neck is sore. And sure enough, that's what Margaret's found. But the history was that the little one had gone for I think it was a CT scan. And they looked and they found, oh yeah, look at this stuff at the lumbosacral junction. But I don't know if they didn't look at the neck, but either way, the neck issue and a disc in the neck became flared up because of the process. Now, whether it was, and this goes for I guess any neck kind of thing. So whether it was, the intubation and what position that they had to put the neck in order to intubate the little one, if that's what they were doing, right? Presumably, whether that was it, or whether it had to do with just being anesthetized in general. And I've seen this in cases with intervertebral disc disease for thoracic spine, lumbosacral disc disease down in here, my lumbosacral disc disease dogs, I've seen this as well. Because when they are out, and they're basically a limp noodle, right? And, they're then put onto the bed, and nobody wants to hurt these dogs, but they're limp noodles. And they likely, if they have some pre-existing issue, disc problem, anything there, they likely are surviving a little bit due to mechanisms of, increased tightness in that region that's holding it together. Now, you make them limp noodle, and things just wibble bobble about, and it can flare things up. So I have seen lumbosacral disc disease dogs become significantly worse after they've been anesthetized for further diagnostics. This little one was cervical spine. I've seen IVDD dogs, and I get it. The diagnostics need to be done, but it can definitely flare up an existing spinal problem. So 2 things to note. And again, if you are in the vet clinic part of these procedures, just to, be extremely cautious, with how you're handling them. And again, I know nobody's trying to hurt dogs, just to be aware that this can happen, and to be careful. And then for the rehab set afterwards, so any of us in rehab, to recognize this can occur and to be quick and ready and prepared to take action to help to alleviate the pain, whether it's through mobilizations, tractions, dural tensioning, nice easy stuff, lots of laser to settle down inflammation, and advocate for that client and owner to seek from their veterinarian some sort of a medical intervention as well that could hopefully, pharmaceutical, there we go, that can hopefully settle down the inflammation as well. So I guess it's just a public service announcement. That's all that this one is about. But just to be aware that spinal issues can be compounded or flared up with an anesthetic. That's it. So until next time, cheers.